More and more states are loosening coronavirus closures and restrictions, and a week from today, you'll likely be able to add Massachusetts to that list. Governor Charlie Baker laid out a four-phase plan this afternoon for the state to reopen, with the hope to start next Monday. But he emphasized the process will be very much gradual and could still change.
There are no guarantees when it comes to dealing with COVID. And our ability to move forward through these phases depends almost entirely on everybody playing their roles. Face covering, staying at home when you feel sick, washing your hands, using hand sanitizer, staying 6 feet away from others whenever possible. It's incredibly difficult to plan for a future while we don't really have real certainties about how this particular virus moves and relates and acts across time.
The governor also said restrictions could tighten in certain areas that see outbreaks or even statewide if there's widespread transmission. As of this afternoon, the coronavirus death toll topped 5,000 here in Massachusetts. But over the past several days, there has been a downward trend in people testing positive, even as more tests are administered. And that's a tool Baker said the administration will heavily rely on in the weeks and months ahead to keep the virus in check.
I do think you'll see a significant expansion of testing, yes. And it will be in the report. But basically, we anticipate a pretty significant growth in testing all the way through the fall.
I'm joined now by Dr. Jeremey Faust. He's an emergency physician at Brigham and Women's Hospital and instructor at Harvard Medical School. Dr. Faust, thanks so much for being here.
Good to be with you.
You know, I didn't know there was any debate at all about whether or not more robust testing was critical to a healthy future until I heard this past Friday.
This is why the whole concept of tests aren't necessarily great. The tests are perfect, but something can happen between a test where it's good and then something happens.
And this afternoon, a couple of hours ago, the president echoed what he said on March 6th, I think it was, at the CDC. Anybody who wants a test can get it. Just to clear the record, are either of those comments close to true or real?
The first comment is a little problematic in the sense that we need to test people more than once in some cases. Just because you weren't pregnant 2 months ago doesn't mean you're not expecting today if you're of age. So we need to watch this very carefully. I don't think that's a subtle point, and I hope that most people understand that, except in this case, it's coronavirus, which can kill your neighbor or you. On the second piece, the number of tests we need to have to be safe is far higher than we have today. We know that we could have had more tests and we need to have more tests. I'm glad to hear that the White House thinks this is a priority. They're testing themselves. That's a very good sign that shows that they believe in the utility of testing, despite the first comment. So I think that most Americans will go along with more testing.
I think it's also, we should clarify one other thing the president said on Friday. This was on Fox and Friends. And I have to say, this surprised me a bit. This is about vaccines.
I feel about vaccines like I feel about tests. This is going to go away without a vaccine. It's going to go away, and we're not going to see it again, hopefully, after a period of time.
Does any public health person in America buy that notion that a vaccine is irrelevant to a solution here?
I think vaccines are our best hope. We should all be watching that very carefully. I think that we need to be investing in that very carefully. And it's going to be there. I look forward to a day when you see people lining up. That's going to be a moment, when, if and when it occurs, that's going to be historic and positive. So to kind of shrug that off doesn't strike me as the way most people feel. And personally, when I'm feeling the lowest about things, I try to imagine the thrill of that moment and the accomplishment that we will collectively feel and the relief. And so let's move forward towards that and ignore anyone who says that that's not worth pursuing. I don't think that's really the policy of the government. I think they're pursuing it, and we should support that.
The debate in every state capital, most cities, and obviously in the White House is about the criteria for reopening. Some governors are talking about more testing, contact tracing, isolation. Others are purely talking about the economic damage having to be reversed. But you, in a piece in the Washington Post the other day, talked about another criterion that should be the determining factor, excess mortality. Explain to us what that is and why that should be the thing by which we should make the determination.
Sure. Excess mortality is the concept that says we know actually every week of every month of every year just about how many people are expected to die in every year. We know what those numbers should be like. We know what early May looks like for the past 100 years. And at the moment, for the first time in really modern history, we are seeing an absolutely gigantic deviation from that. So you don't actually need to tell me whether it was from coronavirus or not. I know it was from coronavirus. That's obvious to all of us. But to know the size of the effect of this, the question people might be saying is, oh, well, how many of these people would have died anyway? And if you look at just all causes of death and count those up and say, wait a minute, why is it 200% normal? Then we know that we're really still in the thick of this. And I think that a major part of the policy to know when we're open, when we're ready to be safe, would be when that goes away. I think that's not the only tool, but I think it should be a major piece of the pie.
I don't know much about medicine and health. I am a very good patient, I should say, but I don't have any experience on your side. But is your position an outlier? I haven't heard that virtually at all, and it seems simple and neat and perfect if it's true. Are you an outlier on this?
I don't think so. I think that most people just haven't thought about it yet. And the reason for that is that in the history of our modern sort of society, we hadn't confronted anything that had such sustained excess mortality. It didn't occur to anyone this would occur. Even in the 2009 H1N1 outbreak, you actually can't tell. If you ask someone to look at the data and say which year between 2000 and 2018 was the bad flu year, they couldn't pick out 2009 as the one because they didn't have enough of this. So we actually, unfortunately, didn't even occur to people that this could be so bad. And so now for the first time it is, and I just wanted to share with people that it's a terrifying opportunity to follow this. So I think that most experts, once they see it, say, yep, that's what we ought to be following.
So even if excess mortality became the criterion, the major criterion, I assume testing would still be critical because deaths lag well behind infection. Is that not so?
Yes, I think that tests are a big part of this, but I would also say on the flip side that, say in the fall, you could have a spike in cases and you actually will not know if these are people who already had the virus once before and for whom they might not die at all. I wouldn't want to shut down society if I found out that 1,000 new cases were diagnosed and 989 of them were actually people who already had the virus and are going to be fine. So you have to put it into context. So the number of tests, the percentage of tests that are positive, but then to me, the big lens through which you view that should be the excess deaths, which can really, honestly, it only lags a little bit. Like even in this state, even though when the data comes out, we know that it's kind of like an election night, only a certain number of precincts are reporting, so to speak. But at the moment, things are so bad that even with a small number, incomplete data that we have, we're already over the numbers we should be. The last time I looked a couple of weeks ago, I looked at New Jersey today just as a side project, and their data came out from 3 days ago. And even though the data is way early, it'll be updated in the next 2 weeks to get all the counts that they expect, they're already way over. So usually it takes 7 to 14 days to get kind of things to settle out. But you know, if on day one you're already over your average, then you're in trouble.
Doctor, one last testing question, if I can. Most people, despite what the president says, can't get a test for the virus. A lot of people have been able to access tests for antibodies. And the conventional wisdom, at least until recently, was test positive for antibodies, you have immunity, go out in the world, you get one of those immunity passports. Is there validity to that or no?
Well, there will be validity to that eventually when we know what levels of antibodies in your blood correlate to immunity. Right now, the tests that work, of which so many of them that were on the market didn't because the FDA allowed some of these tests to go to market without having been vetted. They are now taking that back. So we can get a qualitative yes or no, you've been exposed. But it's going to take a while before we know what that means. So it could be, pick a random number, you've got 1,000 antibodies, in every drop of blood. And it turns out that in order to be immune, you need 2,000 or 3,000. That's what we call titers. And we're going to only find that out based on following up people's numbers and asking, did you get reinfected? That just takes time. So right now we could probably get closer to knowing if you've been exposed. But for my money, I don't know what that means yet, so I wouldn't be guiding policy based on that because the information's too incomplete.
Dr. Jeremey Faust, thanks so much for your time. I really appreciate it.
My pleasure. Thank you.